welcome. Life is precious. Imagine that someone suddenly collapses in front of you after a cardiac arrest and you can't do anything. It's not a scene from a movie, but a scenario that's getting common. Even young adults are suffering from sudden cardiac arrest due to sedentary and stressful lifestyles. Without immediate recognition and CPR delivery, the chance of survival decreases significantly as each minute without life-saving intervention passes. It's been proven that bystander CPR improves the rate of survival by almost 50%. It's even more important if you have a loved one who has a history of cardiac disease, as research reports that the majority of cardiac arrests occur at home. CPR knowledge will equip you with the skill and the confidence needed to transform yourself from the role of a bystander to a lifesaver. Save a Life is an initiative through which people will be made aware of the early signs and symptoms of cardiac arrest so that patients can get to the hospital in time and also be trained on giving CPR if the need arises. Today we have with us eminent cardiologists who can help you understand sudden cardiac death and the role of CPR to revive and save a life. We have with us Dr. Kartik Bhosle, interventional cardiologist, Dr. Kartik Bhosle's cardiology clinic in Pune. We also have Dr. Raghav Sharma, interventional cardiologist from Mediterranean Hospital in Ambala. And we have Dr. Rohit Tandon, consultant physician in charge, non-invasive cardiology, Hero DMC Heart Institute, Dayanand Medical College and Hospital in Ludhiana. Thank you so much, doctors, for joining us on the broadcast. Let me take my first question to Dr. Bhosle to begin with. The early onset of substance abuse is associated with higher risks of developing many health complications. How does it affect cardiovascular health? Dr. Kartik Bhosle.
Yes, thank you, Divya, for kind introduction. Previously, heart diseases were the diseases of the old age, but nowadays that is not true. Even younger population is affecting more and more nowadays. One of the most common reasons for this is substance abuse. Currently, it has been seen that in a age group of 10 to 65 years age, almost 20% of population is using tobacco, either in a chewable form or smoking form. 15% population is having alcohol. Cannabis is 3%, opiates is 2%, and this number is increasing with time. This is mainly because of lack of awareness regarding their adverse events on health, and also easy availability of this substance, cheaper cost, and peer pressure as well. These substances causes very major heart-related problems such as heart attack, the major heart attack, especially in a cocaine abuser or smoker. Then different arrhythmias, that is irregular heartbeats, which might be life-threatening at some point of time. Then certain severe heart infection as well, especially in those who are doing this IV drug abuse, like heroin or amphetamine as well. Weakening of heart muscle. This is especially seen in who uses these anabolic steroids or who are chronic alcohol users. Then high blood pressure, because these substances are stimulant. This causes constriction of the blood vessels, so leading to the increase in blood pressure. And also blockages of the vessels which supply to your arm, your legs, your brain, your lungs, or sometimes heart as well, which can be again threatening to your life. Good thing about these things can be preventable, and these are reversible once you got to know. This we can do by educating people at school, in the school only, regarding their adverse events and how they adversely affect their health. Also by counseling some targeted populations, such as those who are suffering from anxiety and depression, because in them this use of substances has been found to be higher. And also by encouraging people to seek a professional help if they are not able to stop this using these drugs, and also screening them for the heart disease if they are having it.
Right, doctor. Well, what happens if you have an abnormal heart rhythm? Are there different types of arrhythmias? Dr. Raghav Sharma, if you could take that question.
Yeah, so, arrhythmia is a very big topic in itself. So for understanding point of view, what happens is normally when you check your pulse, it is very irregular. So whenever you have an irregular pulse, or whenever you feel that you are missing on pulse, you feel your pulse is very fast, we call it an arrhythmia. Arrhythmia is just like, you can say, heart has 4 chambers. One of the chambers has muscles which start firing. It's like coming like an earthquake. So it has got one epicenter, and it fires in every direction. So you can have high heart rate, you can have slow heart rate, you can have missing beats, as some people say that pulse is not, we are not able to feel the pulse. So basically what will happen is most of the people either they will feel they are having palpitations. Suddenly their heartbeat has become very fast. Some people, if their heart rate is too slow, they may feel giddy or they may even fall down, which we see suddenly we get that we fall down and we have an injury on our head. Thirdly, sometimes if you have a arrhythmia arising from the ventricle part of the heart, you may feel lifeless and you may have a which may be really dangerous. So looking at pulse and assessing the situation is very important.
Right. Also, when cardiac symptoms are recognized early, the condition can be diagnosed sooner and the prognosis gets better. What are the symptoms of arrhythmia? Dr. Rohit Tandon, please, if you could answer that.
Divya, actually, Dr. Raghav has very beautifully explained the symptoms of arrhythmias. Arrhythmia is basically error in the rhythm of heart, like erroneous rhythm. Heart always beats rhythmically. So when you have an abnormality in the rhythm, there is a thumping feeling inside the heart and the chest, and the patient comes to us with a feeling of thumping in the chest, and sometimes he or she feels giddy because of low blood pressure. So this is a problem which usually patient experiences, and sometimes due to lack of increase in blood pressure, there is also giddiness. So these are the problems which an arrhythmia can do. And like what are the causes of arrhythmia? There can be multiple causes, as Dr. Singwani was saying. It could be due to multiple substance abuse. It could be due to taking of some anti-anxiety drug or over-anxiety drugs, caffeine, and sometimes patients who already have a heart disease, for example, who has suffered from a heart attack previously, they may have these problems.
So now we know what arrhythmia is. What are the tests and diagnostics of arrhythmia? Dr. Karthik Bhosle.
Yes, if we suspect arrhythmias, first we ask for an ECG, that is electrocardiogram. An ECG measures the timing and duration of each electrical phase in heartbeat. If we did not find any significant abnormality in it, then usually we go for a Holter monitoring. Holter monitoring is a portable ECG device which can be worn for a day or more to record your heart's activity as you go through your routine activity. If you find something in that, then it's fine. If it doesn't, then we put something long-term monitor, such as event recorder or implantable loop recorder. Event recorder is same as Holter monitoring, in which we give a wearable device and we ask to press a button when that patient feels symptoms like feels giddiness or feels palpitation. And for the implanted loop recorder, we put some chip like a device inside the chest skin, and it will be monitoring continuously their heart activity. Even after these testings, if we don't find any abnormality, then we go for some trigger testing, such as stress test, tilt table test, or some invasive test as well if required, like electrophysiological testing and mapping. If we find the cause, once we confirm that patient is suffering from this kind of arrhythmia, then we also evaluate for the cause for the arrhythmia. For that, we usually do 2D echo, that is echocardiography, and also some blood tests such as thyroid function test or some serum electrolyte levels as well. So by and large, first we do some basic tests and short-term monitoring. If we did not find anything, then we go for a long-term recording of person's heart activity and sometimes invasive test as well. And subsequently, we also evaluate for if any reversible cause is there.
Right. So when we talk about the treatment for arrhythmia, can arrhythmia be cured completely? Dr. Sharma.
See, the point is, yes, now of late we have developed treatment for arrhythmias. If you see interventional cardiology, it has now been divided into different fields. Like one are purely dealing with coronaries, that is blood vessels. Second deals with structural heart, and third comes cardiac electrophysiologists. These people play a very crucial role, diagnosing exactly where is the epicenter of that arrhythmia. And after diagnosing it through a study called cardiac electrophysiology, what we do is we locate that epicenter, and what we do is we try to give a ablation. Ablation is nothing, we give a warmth there and try to block that pathway. So that is called radiofrequency ablation. So this is the recommended treatment along with medicines to be given to these patients. So
what is sudden cardiac death? What are the cardiac arrhythmias responsible for sudden cardiac death? Dr. Tandon, if you could take that.
Yeah, Divya. Sudden cardiac death is a very serious, you can say, emergency in which there is sudden cessation of cardiac activity. That is mostly secondary to arrhythmias. Whenever you have a arrhythmia, for example, you have a ventricle arrhythmia that is pertaining to the heart's ventricle, like ventricle arrhythmia, maybe ventricle tachycardia, ventricle fibrillation, that may ultimately lead to sudden cardiac death. Usually the patient comes to us that the bystanders found him collapsed inside a ground or in his office, and he is brought to us, and when we check his blood pressure and pulse, there is no BP or pulse. He is in complete shock, and the ECG shows no rhythm. This is sudden cardiac death documented. Then we have to do urgent cardiopulmonary resuscitation to revive him and then find the cause of these arrhythmia. The commonest causes of these arrhythmias may be underlying heart disease, that's the patient had previous heart attack, or patient was having some kind of cardiac muscle disease, that is hypertrophic cardiomyopathy or dilated cardiomyopathy, which is now commonly can be diagnosed by a simple 2D echocardiogram or cardiac MRI, or even by simple ECG can guide you whether the patient had earlier some heart problem.
Now, if someone is having a heart attack or a cardiac arrest, what emergency action should be taken by a bystander? Dr. Bhosle, if you could take that question.
Yeah. First of all, I like to clear that cardiac arrest is very different from the heart attack, because management of both these conditions is very different. In cardiac arrest, whole of the heart stops beating, or it beats in a very improper way or very fast way, which is won't be able to sustain a circulation. In case of heart attack, the vessel which supply blood to the heart gets blocked. So that part of heart stops contracting. These both are different things. So in layman words, if I have to make you understand, if someone arrests you, you can't move. You have to be moved by some authority. But if you are attacked by someone, of course you will do something to prevent further attacks. It's kind of that. So to save a life, you have to first suspect the disease. You can suspect the cardiac arrest. If patient suddenly becomes or person suddenly become unresponsive, then you have to confirm this unresponsiveness by giving some painful stimuli or shouting loudly. If there is no response, then check his breathing pattern as well. If there is no breathing or there is very abnormal breathing, very slow breathing or labored breathing, then you can suspect that this person might be having cardiac arrest. Then immediately you have to take some action. First of all, you ensure your own safety. Are you in a safe environment to help him? Followed by that, shout for the help. Ask someone to call an ambulance or a hospital, arrange some transport facility, or bring AED, that is automated external defibrillator. Then immediately you start this quality CPR. CPR is very important, in which you have to press lower half of the chest with your two hands, and this compression has to be an effective one, that is at least 100 to 120 compressions per minute. And if there is a second rescuer available, you can give this mouth-to-mouth breathing after 30 compressions. And also, to be more effective, you have to let the chest recoil completely as well. You have to continue this CPR until and unless that person starts moving or breathing, or someone with more expertise come into the picture. This is about the cardiac arrest. For the heart attack, you can suspect a heart attack when someone is started having central chest pain, which might be of squeezing in nature or pressure in the chest, and which might be going to his neck, shoulder, or arm as well. And it might be associated with cold sweat, lightheadedness, uneasiness, or sometimes nausea and vomiting as well. In that case, you might suspect that this person is having a heart attack. In that case, help the person to sit down, make him lie down, and also reassure him so that he gets calmed down. Loosen his clothes if there are any tight clothing. Then ask for an help, ask for an ambulance, or ask for any transport facilities so that that person can be transported immediately to the hospital. In the meanwhile time, you can give a sublingual tablet, that is nitrates, to relieve his chest pain, or chewable aspirin. This is a blood thinner, and transfer this person as early as possible. During this period, if he becomes unresponsive, then again you have to start the CPR immediately. So in case of cardiac arrest, early confirmation and quality CPR is the key to survival. And for the for the heart attack, early recognition and transport to the hospital is very much necessary to help the patient.
Right, that was very well explained. With that, we're slipping into a very short break. We'll be back on our show, Health and Wellness Save a Life, with our doctors. Do stay tuned. Welcome back to our show, Health and Wellness, Save a Life. We have our doctors with us. Let's go across to Dr. Sharma now to talk about remembering the CPR steps and administering them correctly. Can that be a challenge? Please tell our viewers the correct sequence of steps for CPR. Dr. Raghav Sharma.
So basically there are 7 basic steps which we need to follow when we start the CPR for a patient. The first step is any bystander or person who is standing next to the patient who has fallen suddenly, he should assess the situation and make sure that the person is put on the firm surface. And he should tap the shoulder of person to confirm that he is conscious or not, whether he needs any help or not. The second step is that he should immediately call for an help. If there is no help available near the victim, then he has to be very much on the toes. Immediately open the airway, make the person lie on their back, tilt their head back and lift their chin. And they should remove any obvious blockages which are present on the mouth, like you have any vomiters or you have any broken teeth, it should be removed. And check for the patient whether he is breathing or not. In case he is not breathing, then firmly kneel down by the side of the patient, put your both the hands on the center of the chest and start pumping. Minimum 100 compressions has to be given and over a period of 1 minute, and simultaneously patient should be given mouth-to-mouth breathing, and this whole process has to be repeated till the time you are able to arrive at any emergency or any emergency persons are able to come or anybody comes there to help the patient. So these are the basic 7 steps which you need to follow in these patients before any emergency help arises, whenever you are standing by or any person is needing help.
How important is it for the caregivers, the family members to learn CPR, especially those who have a family member suffering from heart disease? Dr. Rohit Tandon.
Okay, Divya, very nicely Dr. Raghav has given us the steps of CPR. It's a very simple methodology to follow. And we always first select which patients will require CPR. So in our hospital, we have followed a policy, patients who are wearing a red band, that is, they are frail, very old, and they are having a pre-existing heart condition which can lead them towards a need for CPR at home. There we select these patients' caregiver, their relatives, especially if the caregiver is selected from the hospital, he already knows the CPR steps. And we have seen these patients, if they collapse at the home, they are much better off when the patient's relatives have not learned the CPR. So what we do is we make a connection with our staff members, our nurses and our doctors, and we identify these high-risk group patients, and then we start training them. And it has really given us good, fruitful benefits. Now, apart from this, what we propose that all the like transport facilities, for example, our train staff, our railway staff, our airline staff, one of them should know in every flight, in every journey, that they should know CPR steps, which is basic and must for giving us back a precious life. So I think it is a very important step which we can as a society follow.
So when is there a need to do angiography? What is an angiography procedure, and is the procedure based on which stenting is decided? Dr. Karthik Bhosle.
Yes. Angiography is a gold standard test to know whether you are having blockages in the heart vessels. Angiography is usually recommended when you are having heart attack or when we are suspecting you might be having coronary artery disease on the basis of your symptoms. Sometimes we suggest this test when we find some abnormal results from non-invasive cardiac tests such as abnormal ECG, 2D echo or abnormal stress test or sometimes SPECT scan as well. Sometimes we ask for an angiography if some other heart surgery has been planned such as valve surgery. Then also we look for if that person is suffering from heart blockages as well, so that simultaneously both the things can be tackled. Angiography is usually done through hand or groin, preferably hand, if not possible then groin. During this procedure, you will be asked to lie over an X-ray table. The hand or groin area will be cleaned and disinfected with some disinfectant, and subsequently it will be numbed with the local anesthetic as well. A small needle puncture will be taken at the site of from where we are going to perform the angiography, and subsequently a small plastic tube, that is sheath, is inserted there. Through this sheath, a long plastic tube will be introduced, which will be carried towards your heart under the X-ray images. Under these X-ray images, we engage this catheter into the heart blood vessels, and through this external port, we inject a dye as well. This dye passes through this heart blood vessels. While passing this dye, we take some X-ray images through X-ray cameras. These X-ray cameras usually are around over your chest. It will move from chest to head to the different angles, so that we can take pictures in different angles. So after this procedure, we remove the catheter, we remove the sheath as well. We give some local compression as well, so that bleeding does not happen. And after that, we put some bands as well to prevent the bleeding. So on the basis of X-ray images, we see whether this person is having significant blockages or not. If there are significant blockages, then usually we ask for an angioplasty, that is stent placement, or maybe if required bypass surgery as well. And if there are no significant blockages, then we just ask for a medical management to follow up in open. Usually after the angiography procedure, we may discharge that patient on the same day on the findings which we get on X-ray images. So overall, angiography is a very low risky procedure, and it's a very informative procedure to know whether you are having heart blockages or not there.
So does taking painkillers increase the risk of heart attack or stroke? Dr. Raghav Sharma.
See, as far as the painkillers are concerned, so of late there has been an increase in the use of painkillers. A lot of people are taking painkillers for body aches and having knee problems. Some people are having cervical problems. Especially these cardiac patients who are on heart medications, when they take these painkillers, they are definitely at higher risk of repeat heart attacks and deaths. There are multiple reasons, because painkillers, number one, they block they don't have a vasodilatation effect. That is, they don't dilate your vessels. Heart vessels are like pipes. So these painkillers inhibit substances which our body generate, which helps in causing dilatation. So number one. So that is one biggest disadvantage of using painkillers, especially in cardiac patients. Secondly, there are a lot of studies which have come of late. Painkiller causes a lot of damage to the kidneys. So once your kidneys start getting damaged, again your blood pressure starts increasing. And as your blood pressure increases, again we all know there are a lot of late we are seeing a lot of patients who are coming with high blood pressure are most potential candidates for developing further cardiac problem as well as stroke. So in a way, painkillers are very, very dangerous and should not be used, and only be directed by the concerned physician to be used for a very short period of time.
Right. Thank you so much, Dr. Raghav Sharma, Dr. Tandon and Dr. Bhosle for joining us, and thank you so much for watching our show, Save a Life. We'll be back at the same time tomorrow. Thanks for watching.